Let's listen to Mr. Daniel Elkerlees. Now, he's the chief executive of something called NHS providers. Not to be confused with the NHS. It's sort of part of this thing called the NHS Federation. I can never quite work out what they do. They sort of work with providers who supply the NHS. They're supposed to coordinate the various businesses that aid the NHS. They're basically rah cheerleaders for our national health system.
Like an arm's length organisation.
Sort of left wing, isn't the NHS great? No, it's crap. Anyway, Daniel Elkerlees, the chief executive of this non-NHS organisation, who isn't a doctor and isn't medically qualified, used to be chief executive of St Helier Hospital, massive hospital in South London. So he's a sort of health, professional health executive, middle manager type. He went on to Times Radio the other day and he said this.
When you were talking about it being like COVID, I think we need to get back into the habit that if you are coughing and sneezing, but you're not unwell enough to not go to work, then you must wear a mask when you're in public spaces, including on public transport, to stop the chances of you giving your virus to somebody else.
How do you know? You're not a doctor. You know, what is going on here? What with this guy who's not a doctor telling them you must wear a mask? No. How about that? No, I won't. Also, these face nappies, I mean, whether or not they work is an interesting question. A significant number of experts say that they don't, that they do not stop the spread of viruses. And the University of East Anglia conducted this huge study after COVID, and they concluded that donning face masks did not lower the risk of COVID infections. So there's a strong argument to say face masks don't work. So I think that face masks have become a weird symbol of, left-wing compliance, compliance with the government. Wear a mask. During the COVID, when you were, got arrested if you didn't wear a mask. Do you remember those times, Philip? I had to come to work, and I remember, there's one more thing you had to remember when you went out: your keys, your work pass, and all that. And it's like, where's my mask?
Where's your face
because you couldn't get on the tube unless you wore one. But there is the evidence that they actually work, that they're efficacious in stopping the spread of viruses, is pretty weak.
Yeah, there've been several studies actually that say that, and this is all about the NHS, the perma-crisis NHS, and saving the NHS, isn't it? And he was like straight from central casting, wasn't he? It's almost as though, hey, maybe we need to change the model of the NHS, which is the 1947 model for the country as it was in 1947. It's a different place now, 80 years later. But there's something about this which, as you say, Kev, and I think you're absolutely spot on, it's symbolic. It's up with the banging of the pots and pans on the Thursday night, isn't it? It's something about this we're part of this socialist utopia that doesn't work, but we're going to carry on insane style, even though it doesn't work, worshipping it. And there's something really disturbing.
It's a sign of your compliance.
Yeah, there's something really disturbing about it, because everybody knows that these masks don't work, because that's what all the sensible studies say, and yet people like him, who's supposed to be a professional, kind of. I mean,
there are experts who the narrative around face masks was and still is that if you wear one of those surgical ones, those the ones that look like a suit of armour that they wear in hospitals, that yes, they of course they can be quite effective, but we can't go around. But if you wear those sort of just those nappies that go around, a lot of experts will tell you that they're just completely useless. Some will say they may have a marginal effect. Some might say that they do think that they work. But wearing a mask, we don't need people like Daniel Elkerlees telling us that we must do it. It's our decision, and I've looked at the evidence. My decision is I'm not wearing a mask because I don't think they work. I'm not saying definitively they don't work because I'm not a doctor, I don't know, but the evidence that I've seen means I'm not going to make myself look like something stupid for no reason.
Well, when I used to have to wear one, I looked like, with these glasses, I looked like Claude Rains in The Invisible Man. But I was just coming over here before on the tube, and there was someone wearing one of those nappy-type masks, and there were two big folds at the side there where air could get in and get out. Yeah. So you don't need to be an expert to know that they don't work. Yeah. You just need a bit of common sense. But it's this dystopian aspect of it. You know, everybody's walking around like robots wearing these masks and conforming. And
we must get that, guys. We must get back to wearing masks, because people like Daniel. Well, I don't know Daniel. I'm probably doing him wrong here, but people like Daniel, I think they enjoyed those days where people, Chris Whitty and Patrick Vallance and Boris Johnson and Matt Hancock were ordered wear masks, they enjoyed those days.
And the thing is, if you're catastrophizing about all of these things, you don't have to worry about the actual stuff that's going on day to day in the NHS and in the country. So they love these big things, don't they? More flu, more, oh God, we're in catastrophe, everybody's got to work together, and people have to suspend their kind of judgment on other kinds of things, and let's move the narrative away. It's easy for them.
Yeah, I mean, Carl Hennigan, Dr. Carl Hennigan, Professor Carl Hennigan from Oxford University, comes on this channel quite a lot. He says that, you can wear them if you want, but you're probably wasting your time. I mean, people, laymen, non-medical experts, they want, well, of course it works, of course. Well, no, because viruses are very small.
They are pretty small.
They're not blocked by bits of material, because bits of material are actually a lot of woven things, with holes in them. So, it's up to you. But what do you think of these people? Aren't even doctors. So you must return to wearing masks. Will you wear a mask? We've got this alleged super flu epidemic at the moment. Will you wear a mask? Do you think masks work? I suppose if you don't think they work, why bother wearing them? I mean, I'm not going to wear a mask for this reason. I think masks are a sign of authoritarian control. That if you wear them, you're doing what the government and what the NHS tells you. So I am not going to wear a mask because I want to send a message to those people. I'm not going to do what you tell me, because I'm a sovereign individual, and it's not your job to tell me whether or not I put nappies across my face.